Mr. McConnell?
Mm-hmm.
Hi, my name is Kate. I'm a nurse practitioner student. I'm going to be working with you today, okay?
Okay.
All right, can you verify your first and last name for me?
Lewin McConnell.
And when's your birthday?
7/3 of 84.
Alrighty. I just wanted you to know that everything we talk about in this room is confidential, okay?
Okay.
Tell me why you're here today.
I have a sore throat.
Okay. And how long has that been going on?
About 3 days.
Okay. Did that come on suddenly, or did it kind of work up to that sore throat? Was there something else going on?
Just kind of all of a sudden.
Okay. When did you first notice it? Where were you?
In the morning when I woke up.
Okay. Is the pain localized to your throat, or does it radiate anywhere else? Do you have pain anywhere else?
No, man, it's just my throat.
Okay. Could you describe the pain? Is it sharp, stabbing, sore?
Kind of stabbing.
Stabbing, okay. On a scale of 0 to 10, if 10 is the worst sore throat you've ever had and 0 is no sore throat, where do you fall on that range?
About a 6.
Is there anything that makes the pain worse?
Just having no fluid in me.
Okay. And what makes the pain better?
Whenever I'm drinking water.
Okay. Are there any other symptoms that you're concerned about? Do you have a fever or cough, anything that you've noticed?
No, ma'am, not that I've noticed.
Okay. All right. I'm going to go through quite a few questions after this. This is your first time with us at this office, so bear with me, it's going to be a lot of questions, but we just want to kind of get a feel for your medical history so we can kind of look at you as a patient as a whole, okay?
Yes, ma'am.
Do you take any medications, prescription medications?
No, ma'am.
Okay. Do you ever take anything over the counter?
Tylenol.
Okay. How often do you take Tylenol?
Only whenever I have a headache.
And how often do you think that is?
Maybe once a week.
Once a week. And how many Tylenols do you take at one time?
2.
Do you take any vitamins, supplements, herbal medications?
No, ma'am.
Are you allergic to any medications?
No, ma'am.
Any allergies to any foods?
No, ma'am.
Are you allergic to latex or plastics?
No, ma'am.
Any environmental allergies like dust, pet dander?
Just pollen.
Pollen, okay. Are you up to date on your vaccines?
I believe so.
Okay. So as a child, do you believe you had your measles, mumps, rubella vaccine?
Yes, ma'am.
Okay. Pertussis and polio?
I'm sure.
Okay. Have you ever had a hepatitis A or hepatitis B vaccine?
No, ma'am.
Okay. How about the varicella and herpes zoster vaccines?
No, ma'am.
No. Do you know if you've ever had a meningococcal vaccine?
I believe whenever I went to college.
Okay. And how long ago was that?
2004.
Okay. Ever been vaccinated for smallpox?
No, ma'am.
Okay. When was your last tetanus booster?
About 5 years ago.
Okay. And why did you have that done?
I stepped on a rusty nail.
When was your last flu vaccine?
Year before last.
Okay. And have you had a TB test, skin test done?
I've had it done, but I don't remember when.
Okay. Ever had a pneumonia vaccine?
No, ma'am.
When was the last time you saw a doctor for a physical?
About a year ago.
Okay. Did they find anything outstanding on that? Anything remarkable?
No, ma'am.
As a whole, how would you describe like your general health and mental well-being?
I think it's good.
Okay. As a child, did you have any of the following illnesses? Did you have measles, mumps, or rubella?
No, ma'am.
Okay. Do you remember having chicken pox?
No, ma'am.
Okay. Ever had pertussis or whooping cough?
No, ma'am.
How about rheumatic fever or diphtheria?
No.
Okay. Did you suffer from childhood asthma?
No, ma'am.
As an adult now, have you ever been diagnosed with any type of cancer?
No, ma'am.
Okay. Ever been diagnosed with heart disease or high blood pressure?
No, ma'am.
Okay. Any problems with your thyroid?
No, ma'am.
Diabetes?
Nope.
Okay. Ever been diagnosed with a sexually transmitted disease or any form of hepatitis?
No, ma'am.
Pretty healthy guy?
I think so.
Alright. Ever been in the hospital?
Yes, ma'am.
Okay, what was that for?
I had surgery on my ankle.
Okay.
I had sinus surgery, and I had vasectomy.
Which ankle did they operate on?
My right ankle.
And how long ago was that?
About 9 years ago.
Okay. And your sinus surgery, how long ago was that?
Year and a half ago.
And do you know why you did that? Were you just having a bunch of infections, or?
Doctor said that there wasn't a whole lot of air moving through my nose, so he cut me open.
Okay. And how long ago was the vasectomy?
This last April.
Okay. Any other surgeries in your past?
No, ma'am.
Any major traumas or injuries?
No, ma'am.
Okay. Have you ever received a blood transfusion?
No, ma'am.
Do you feel like you have any type of disability at all?
No, ma'am.
Now I'm going to kind of go through your family history. We're going to talk about your mom and your dad and your grandparents. And I want to know if any of them are living or if they've passed away and whatever health conditions they have. So is your mother still living?
Yes.
Okay. Does she have anything like high blood pressure, stroke, heart attack, anything like that, and cancer?
I believe she has AFib.
Okay. And your father, how about him?
Same thing.
So he is living with AFib?
Yes, ma'am.
Okay. Any other health conditions for him?
No, ma'am.
Do you have any siblings?
I have a sister.
Sister. Does she have any health concerns?
Not to my knowledge.
Your mom's parents, your mom's father and mother, are they still living?
No, both of them are dead.
Okay. And your mom's mom, how old was she when she passed away?
76.
Do you know what caused her death?
Cancer.
Do you know what her cancer was?
It was kind of widespread over her entire body, so it was just I don't know where they localized it.
Okay. And your mom's dad?
I was very young whenever he passed away. So
do you know how he passed?
I know that he smoked his whole life, and he had I want to say COPD as well as emphysema.
And your father's parents, are they still living?
No.
Okay. So let's start with his mom.
She had Alzheimer's,
and
it just kind of slowly took her.
Okay. And your father's father?
He I think he's like 84, and he had it wound up being just organ failure. He had an enlarged heart and a bunch of other different things, and I think he also had COPD.
Okay. Sorry to hear that. Do you use any tobacco products?
Yes, ma'am.
Okay. What do you use? What type?
Right now, I did.
Okay. Have you ever smoked?
Yes, ma'am.
Okay. How long ago did you smoke?
I haven't smoked in about 4 years, but prior to that, I smoked about a pack a day.
Okay. For how many years?
For about 10 years.
Okay. And you said you currently dip?
Yes, ma'am.
And how often do you do that?
About 2 dips a day. I can make a can last 2 days, probably.
Okay. And you've been doing that for how many years?
Right at 4.
Okay. Any alcohol use?
Yes, ma'am.
Okay. What do you primarily drink?
Just beer.
Okay. And how often?
Every day to every other day.
Okay. Usually how many beers do you have each day?
About 3 or 4.
Okay. Any history of illegal drug use, illicit drug use?
No, ma'am.
Okay. Ever taken any prescriptions that weren't prescribed to you?
No.
How far did you go in school, Mr. McConnell?
I graduated college
Okay.
with a bachelor's.
Awesome. And what do you do? Do you work now?
Yes, ma'am.
What do you do for a living?
I work for Mueller Incorporated. I'm a branch manager.
Okay. How long have you been in that job?
In that position, I've been there for about 2 years.
Okay. At your job, are you exposed to any harmful chemicals or products or anything?
No,
ma'am. So on the flip side, for fun, what do you like to do?
Hang out with my wife and kids and play golf as much as I can.
Okay.
Besides that, just kind of hang out.
Okay. Speaking of wife and kids, where do you live?
I live in Forney.
Okay. Do you live in a house or an apartment?
Live in a house.
Okay. So you said you have wife and kids.
Yes, ma'am.
Is there anyone else living in the house?
No, ma'am.
How many children do you have?
2.
Any pets?
No, ma'am.
Are you currently or have you ever served in the military?
No, ma'am.
Okay. Do you ever suffer from like frequent fever, chills, body aches?
No, ma'am.
Okay. Ever experience night sweats, waking up sweating?
No, ma'am.
Okay. Do you feel like you sleep well?
For the most part.
Okay. Do you eat well?
For the most part.
As far as your skin, have you noticed any rashes, itching, changes in your skin color anywhere?
No, ma'am.
Any abnormal hair or nail growth?
No, ma'am.
Do you suffer from headaches?
No, not really.
Okay. Do you feel any pressure in your sinuses or pain?
It's seasonal.
Just seasonal when with the pollen?
Yes, ma'am.
Okay. Do you experience any dizziness?
No, ma'am.
Your vision, do you wear glasses, contacts?
Or contacts.
Contacts, okay. How long have you worn contacts?
Since I was about 13.
Okay. Do you ever have blurred vision, double vision?
No, ma'am.
In your hearing, do you have any problems with your hearing? Any ringing in your ears? Feel like it's muffled, decreased? No.
No.
Any changes in your voice that you've noticed? It's hoarse, raspy?
Under my throat hurts.
Okay. Ever had any bleeding or swollen gums, tooth abscesses?
No, ma'am.
Okay. Any ulcers in your mouth?
No.
Okay. Do you ever experience any shortness of breath?
Whenever I'm running.
Whenever you're running, okay. So does it get better if you rest, or does it continue?
It's better whenever I'm not running.
Okay. Okay. Do you have a cough?
No.
Experience a form of cough? Okay. Ever experienced chest pain or palpitations where you feel like your heart is racing?
Only when I'm running.
Okay. Ever noticed any swelling in your legs?
No, ma'am.
Have you ever had any heart testing? I know your family's got a significant history of heart issues. Have you ever had an EKG or an echo or stress test where they put you on the treadmill or anything like that?
Yes, ma'am.
Okay. When did you have that done?
About 3 years ago.
Okay. And were there any abnormal results from that?
No, everything came back fine.
Okay, great. When you're walking at work, I assume you do a lot of walking. Do you ever experience a lot of any pain in your legs when you're walking? Have you ever had a blood clot in your legs?
No, ma'am, not to my knowledge.
Okay. You said you eat pretty well. Do you have any intolerances to any foods like milk, dairy products? No. Okay.
No, ma'am.
Have you ever had a stomach ulcer or frequent heartburn?
No, ma'am.
Okay. Do you have nausea and vomiting?
No.
Do you feel like you have regular bowel movements? Do you
Yes, ma'am.
suffer from diarrhea or constipation ever?
Only whenever I'm sick.
Okay. As far as caffeine goes, do you have a lot of caffeine intake?
I drink coffee in the morning and probably about a Coke a day or so.
Every day?
Yes, ma'am.
Okay. Do you ever experience painful urination?
No.
No. Ever had any flank pain after your kidneys or anything like that?
No, ma'am.
Any discolored urine, dark, cloudy?
No, ma'am.
Okay. Do you get up during the night to go to the restroom?
Only if I drink too much water before I go to bed.
How old were you when you entered puberty?
13?
13. Okay. And do you feel like you have a healthy sex life?
Yes, ma'am.
Okay. Do you have any pain, redness, stiffness in any of your joints? Any decreased range of motion that you're concerned about?
No, ma'am.
Ever had a seizure or migraine?
No.
Okay. Do you have any difficulty with your memory?
No, ma'am.
No. Any numbness and tingling in your extremities, in your hands and feet?
No, ma'am.
Have you ever noticed, I know you've got the sore throat now, do you have any tenderness and swelling in your lymph nodes?
Right now, I'm a sore throat.
But on a normal basis?
No, ma'am.
Do you bruise easily?
I don't believe so.
Have you recently experienced any unexpected weight gain or weight loss?
Gain?
Gain?
Yes, ma'am.
Based on?
Eating and drinking 4 beers a day.
Okay. Okay. Do you find that you're excessively thirsty? Do you have to drink a lot of water? Or do you just feel like you can't get your thirst quenched?
No, ma'am.
Okay. Do you have any intolerance to heat or cold?
No, ma'am.
Do you have any trouble with depression or anxiety? Ever feel depressed or anxious?
That's my knowledge.
Do you have difficulty concentrating on the tasks in front of you sometimes?
No, ma'am.
Okay. Do you often feel irritable, agitated, or tense?
No, ma'am.
Do you suffer from insomnia or excessive drowsiness?
No.
No? All right. Well, we are going to get you taken care of for the sore throat. Okay. Thank you for bearing with me. Is there anything else that you want to discuss that I can go over today?
No, ma'am.
Okay. Thank you so much, and we'll get you checked out. We'll get that throat taken care of. Okay.
Sounds great.
Okay.